Hello, my name is Tatiana Palukche, and I am Assistant of Infection Diseases and Dermatovenerology Department in South Kazakhstan Medical Academy. Today lecture about typhoid fever. Typhoid fever is an infection feverish disease caused by bacterium Salmonella typhi, Salmonella enterica cerevar typhi, and less commonly by Salmonella paratyphi. It is acute generalized infection in reticular endothelial system, intestinal lymphoid tissue, and the gallbladder. The infection way comes from another human, either in ill person or healthy carrier in the bacterium. The bacterium is passed on with water and food and can be withstand both drying and refrigeration. The best-known carriers was Typhoid Mary. Mary Mellon was cook in Oyster Bay in New York in 1906, who is known have to infected 53 people, 5 of whom died. Later returned with false name but detained and quarantined after another typhoid outbreak, and she died of pneumonia after 26 years in quarantine. This infection caused by bacterium Salmonella typhi. It may spread by ingestion of contaminated food or water, or contact with acute case of typhoid fever. May be spread by water is contaminated when inadequate sewerage system and poor sanitation, or may be spread by contact with a chronic asymptomatic carrier, or eating food or drinking beverage that handled by person carrying and bacteria. The species that cause enteric fever are Salmonella enterica serotype S and serotype paratyphi A, B, or C. Epidemiology: it is enteric fever is a global health problem affecting an estimated 12-33 million people per year. The disease is endemic in many developing countries, including Indian subcontinent, Asia, Africa, and Central and South America. The organisms are spread by injection of fecally contaminated food or water. Here present some map where registered high cases in typhoid fever. How is typhoid fever contracted? Typhoid fever is contracted by ingestion of bacteria in contaminated food or water. The bacteria itself only lives in human and is carried through the bloodstream and intestinal tract. Both ill people and carriers of diseases spread the typhoid bacteria through their feces. Affected organs here present like liver, gallbladder, stomach, small intestine, and large intestine. Pathogenesis in this infection complicated, but by scheme, injection of contaminated food or water will enter the Salmonella typhi. Then this invites small intestine and enters the bloodstream. After this, carries by white blood cell in liver, spleen, and bone marrow. Next stages multiply and re-enter the bloodstream. After this, bacteria invite in gallbladder, biliary system, and lymphatic tissue of bowel and multiply in high numbers. Then pass into the intestinal tract and can be identified for diagnosis in cultures from stool tested in laboratory. Clinical features. So the incubation period range from 5 to 21 days, depending on the inoculum size, age, gastric acidity, and host immune status. Here present some abdominal symptoms like diarrhea, constipation, or abdominal pain. It is may initially develop, then resolve. This is followed by non-specific symptoms, so may be present chills, diuresis, headache, anorexia, cough, weaknesses, sore throat, muscle pains, dizziness, delirium, or psychosis, and prior the onset of fever. On examination, patients are actually ill with fever, raw spots, abdominal tenderness, and hepatosplenomegaly. Cervical lymphadenopathy, respiratory crepitation, cholecystitis, pancreatitis, seizures, or coma may also occur. For diagnosis, we use culture. Definitive diagnosis requires isolation in organism from culture or blood. So 40–80% positive, in stool 30–40% positive, or bone marrow 50–90% positive. Other diagnostic samples include urine, raw spot, or duodenal contents. We use some serology. Tests like the Vidal test detect antibodies to Salmonella typhi. There are limited clinical utility in endemic areas because they do not distinguish recent from past infection. And newer ELISA and dipstick tests are better, but their sensitivity and specificity are not adequate for routine diagnosis use. So most famous and popular diagnosis for this for typhoid fever, it is Vidal test. It tests involving agglutination of typhoid bacilli when they are mixed with serum containing typhoid antibodies from individuals having typhoid fever. It is used to detect the presence of Salmonella typhi and Salmonella paratyphi. In typhoid fever, we can see some stages. Incubation period between infection and appearance of signs and symptoms, prodromal period, clinical phase, and recovery phase. For management, we use spread emergent and medial strains. It is resistant to ampicillin, cotrimoxazole, and chloramphenicol, and increasing resistance to fluoroquinolones have made treatment challenging. Antibiotic selection depends on local resistance patterns, patient age, whether oral medication are feasible, and the clinical setting. Fluoroquinolones are the first-line treatment for uncomplicated enteric fever, apart from in areas with high rates of resistance. And regimes include ciprofloxacin 500 mg doses or ofloxacin 400 mg doses by day for 7–10 days. And there are bactericidal and concentrate intracellularly in the bile and result in faster resolution of fever. Ceftriaxone we use in 4–3 gram daily for 7–14 days is indicated in severe systemic diseases in patients with suspected fluoroquinolone resistance. Alternative agents include cefixime 20 mg kilogram a day in 2 divided doses for 7–14 days. Azithromycin also useful, so here we use 1 gram stat followed by 50 mg daily for 5–7 days or 1 gram daily for 5 days. Or we using chloramphenicol in doses 2–3 gram in 4 divided doses for 14 days. Other management include using corticosteroids. So early studies in 1980 suggested that dexamethasone was associated with reduced mortality in critically ill patients treated by chloramphenicol. It is not certain whether then finding would be confirmed in the post-chloramphenicol era. And last management includes surgery. This is indicated in patients with ileal perforation. For prevention, we use two main typhoid fever prevention strategies. It is vaccination. For vaccination, we use first type of vaccine, like contains killed Salmonella typhi bacteria. It is administered by a shot. Second type of vaccine contains a live but weakened strain of the Salmonella bacteria that causes typhoid fever. It is taken by mouth. Thank you for attention.